Hi, welcome back to my office. This is one of several of these webcasts that I've done on healthcare. We're back in Washington now. It was, I think, a good recess. As you know, Jack Reed and I did a couple of my community dinners together on healthcare. We had a very good turnout. I thought that, unlike in other states, everybody's behavior was very cordial and respectable, and the discourse was good and was helpful, both for Senator Reed and myself. We had President Obama give his big address just the other night, and I think that was helpful here in Washington. I think it certainly helped bind the Democrats together. It seems to have accelerated the efforts of the Senate Finance Committee, which is finally moving forward with some legislation. They're the last committee that needs to act. The Help Committee that Jack Reed and I both served on has already voted out a piece of legislation that we are both very proud of, that I think provides a very good model for healthcare reform. And so the fact that the Finance Committee, the last of 5 committees in Congress to look at this, is finally moving is a good thing. And I feel better momentum than I did before the president's speech. So we obviously have strong opposition down here from some of our Republican opponents. I think for many of them, there is nothing that President Obama could propose that they would agree with. They want to hand him a defeat, and they don't care about the merits. They simply want to win this as a partisan fight. And so you've seen a lot of the ridiculous things that have been said about what is included in healthcare reform. And I think one of the important things about President Obama's speech was that he cut through a lot of the lies, he cut through a lot of the propaganda, he cut through a lot of the fog of fear that has been thrown around this issue. And I thought he was clear and cogent and gave a good description of where we intend to go and why it's so necessary that we get there, why we are in such trouble if we don't, why even Americans who have health insurance now that they think they can count on who have no security and no stability in that health insurance unless this reform goes forward, because we continue to head for this deficit precipice on healthcare if we don't get the cost side under control. So here we go, back to work. I am optimistic that with the Finance Committee going forward, with the more active support of President Obama, and with the continued imperative of our situation behind us, we will indeed finally get this done and get for Rhode Islanders and for Americans a healthcare system that they can be proud of, a healthcare system that serves them well, and a healthcare system that does not drain our national economy. So wish us luck, keep in touch. I am working hard down here to make that happen, and my confidence is strong. Take care, and thank you for listening.